Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Andy H. Wynn, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Dr. Bob Mullen from the Legacy Church of Christ in North Richland Hills. After the invocation, please remain standing for our pledges. Thank you very much.
Thank you, Judge. Commissioners, good morning. Let us pray. God, thank you for this time to be able to deliberate the business of the county. We pray for our judge and commissioners as they listen to the information they receive to take care of both the routine and extraordinary things that are going to come before them today. We pray that you be with them and give them wisdom and ability to make the decisions in the best interest of the constituents of this county. I pray in the name of the Lord. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. On the Texas flag, I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you, Doctor. Thank you. Mr. Manius.
Your Honor, we do not have any agenda announcements at this time.
Yeah, that's amazing. Court members, you have before you the minutes of our regular meeting of October the 14th.
Move for approval of the minutes. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. We have a proclamation. I guess Commissioner Brooks, I believe you have a proclamation.
I do, Your Honor. It is in recognition of Food Day in Tarrant County. And before I ask you to read it into the record, let me say that Tarrant County in general is a place where food is pretty readily available. However, there are pockets within our community that suffer from great food insecurity. There are indeed even food deserts within the relative wealth and food security of the overall county. Food Day seeks to recognize both our assets and our opportunities to do better. And I would hope that we as a county will adopt programs that will help us do better so that all communities across this county will have the same access to fresh food, to fruits and vegetables and fresh meats that every other community has. Your Honor, would you please read the proclamation into the record?
You bet. Whereas Food Day is a year-round nationwide celebration of and movement toward more healthy, affordable, and sustainable food, culminating in a day of action, and whereas this day was created by the nonprofit Center for Science in the Public Interest and driven by a diverse coalition of food movement leaders and citizens, their aim is to bring individuals closer to real food that is produced with care for the environment and animals, as well as the women and men who grow, harvest, and serve it. And whereas Food Day addresses pressing food issues such as poor diets, food insecurity, hunger, and food safety, as well as the unsafe conditions of food and of farm workers. Whereas national partners include the American Public Health Association, National Sustainable Agriculture Coalition, Farmers Market Coalition, and many others. And whereas Food Day seeks to inspire the action of the communities of every city and state of this country with the coming together of individuals and organizations to learn, debate, and mobilize to improve our food system and the American diet. And whereas this year Food Day was promoted to 40 school food service directors at the Texas Department of Agriculture's Education Service Center Region 11 Directors Meeting, and also to 40 to 50 organizations at Tarrant Area Food Banks Partners Agency Conference. And whereas we applaud the many efforts the Tarrant County Food Policy Council has made and continues to make by hosting Food Day in Tarrant County and organizing events such as the Apple Crunch that will provide county citizens with thousands of apples in the heart of downtown Fort Worth, now therefore be it resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim Friday, October the 24th, 2014, as Food Day throughout Tarrant County, in witness whereof we have hereunder set our hands and caused the seal of Tarrant County to be affixed this 21st day of October 2014.
Move approval, Your Honor.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
I'm going to ask Ann Sawyer Caldwell, Associate Director for Community Health Promotions with the Public Health Department, and Sherry Simon, the Treasurer of the Food Policy Council and Vice President of Nutrition and Health Programs for Meals on Wheels of Tarrant County, to please come forward and accept this proclamation.
Good morning.
Good morning. On behalf of Ann and myself, board members of the Food Policy Council, we'd like to thank the citizens and the good commissioners here for this proclamation in Tarrant County. We're coordinating over 30 events to commemorate Food Day. Our big event will be this Friday at noon at the Health Department with a film viewing of a film called Nourish. So I'd like to invite anyone who would like to come out and see that film, and we certainly appreciate your support of Food Day and access to healthy foods for all citizens in Tarrant County. Thank you.
Thank you.
Thank you.
Now, we do have kind of a tradition to, look at the last weekend and some of the football games, and of course the Frogs have continued to do very well. I actually had brought along for one of our other deals, somebody might want to actually wear a sack. It's a pretty small sack, but after last weekend's game, if they did have the big head, I think that would have shrunk to the point. And it is kind of a spec sack, because I figured you probably need a little alcohol after the beating that you took. Yes, after the beating that you took last week. It was humbling. Kind of took the whoop out of the whoop.
It's still in us.
It is, I know, and there will be better. You just happened to pick the wrong week to be playing Alabama after they had gotten beat and after they had been kind of called out by every sports channel in the country from that standpoint. So they came a little loaded for bear.
It gives us something to look forward to.
Yeah, unfortunately, it may be LSU on Thanksgiving Day. Court members, you have before you the consent agenda.
Move for the approval of consent agenda.
Second.
We have a motion and a second to approve the consent agenda. Any discussion? Please vote. Motion passes unanimously. Mr. Manius.
Just a comment, if I could, on the non-narcotics forfeiture fund. I think we're approving $5,000 today, but I think that we need to take a look at that fund, and let's make sure before we approve more, if we get any more requests, we need to make sure where we're at on that.
Thank you, Commissioner. That is a good point. I'm glad you brought that up, because that was something else that we kind of looked at. In fact, I'd asked the auditor to kind of look back, and it's my understanding that there's what's the balance in the fund right now?
The balance in the fund today is 151,608.
Okay.
151,608.
Before this comes out?
Yes.
Okay.
But there is a salary that's charged, an ongoing salary.
Really?
Let's see where that was charged.
Oh, it may not be billed. It's an
not.
authorized position.
Right, there was no charges.
Okay.
Well, I think this one is going for a very good cause, but I just think that we need to take a look at it before.
Yeah. I think that's a very good point. And
I
something
agree
for
with
the-
the Commissioner.
Okay. Thank you, Commissioner. Mr. Manius.
Your Honor, our first item is going to be addressed by Mr. Mendez.
Good morning.
Good morning, Mark.
We have for your consideration this morning two legislative policy statements in anticipation of the 84th legislative session starting in January. The first one of these has to do with policy statement in support of air quality initiatives as the state moves towards complying with the Federal Clean Air Act. I would call your particular attention to the first bullet under the policy statement. This language is in support for our LIRAP program and our local initiative projects in support of the full appropriation of the money that is being currently collected here during our inspections. Right now, the state is holding up approximately $200 million to balance the state's budget and is only appropriating a very small percentage of those funds that were collected locally and should be spent locally on our projects. The language that's in this statement is consistent with the language that was recently adopted by the Council of Governments and the RTC, and it's my understanding that we do have some support from the Senate Chairman and the House Chairman of the Transportation committees to move forward with this effort to bring those funds back to our region. You have to answer any questions.
I move approval of the resolution with the comment that if this is the way the legislative session is going to go down, with the state balancing its budget on the backs of counties and municipalities, we might as well draw the line here.
There's a motion.
Second?
We have a motion and a second. Any other discussion? Please vote. Motion passes unanimously.
The second issue is an issue that was brought to us by the Justices of the Peace of Tarrant County, and this has to do with the 72-hour marriage waiting period waiver. Currently, when a marriage license is issued, there is a 72-hour waiting period before the marriage can be conducted. A waiver is available, but only if granted upon a written request by a judge of a court with jurisdiction in family law cases, justice of the Supreme Court, a judge of a court of criminal appeals, a county judge, or a judge of the Court of Appeals. The JPs are saying that they would like to be added to that list of judges that can grant this waiver upon a finding of good cause, that marriage should occur within a shorter time within that 72-hour period. They are requesting that the county put some effort forward to seek this change in the legislation. We've had some discussions with the state association. They are generally going to, at this point, remain neutral on the issue because it's more of an urban issue than a statewide issue, although if this change is made, it would apply statewide.
I'll move approval of that policy statement as well.
Second.
A motion, a second. Any discussion? I guess a little bit in my mind, I would, I understand the family law judges especially, they see a lot of cases. I don't guess I'll have any heartburn over this, but I would almost like to have stopped and thought a little bit more about that because, and have we asked any of
Let
the
me
judges?
present you with an example that just occurs to me. Say that there is someone who is going to be deployed.
That's a good point.
And would like to marry his sweetheart his or her sweetheart before their deployment. We ought to be able to accommodate that at the lowest level of approval that we can, and that would be at the JP court. They're probably the ones going to perform the ceremony anyway.
Okay. There being no other discussion, please vote. Motion passes unanimously.
Thank you.
Thank you. Mr. Mendez, I would ask that you be sure and talk with each one of our department heads and elected officials to be sure that there's not other things, specifically, talk with public health and some of those folks to see if there's anything that we might need to be looking to do legislatively.
Yes, sir.
I move to
Mr.
receive and file personnel agenda.
Second.
We have a motion and a second to approve and file the personnel agenda. Any discussion? Please vote. Motion passes unanimously.
Good morning and thank you. We have one additional item, that's item number 2. We're asking the court to approve an out-of-class pay extension for veteran services. As indicated in your court communique, we have a veteran services counselor who assumed the responsibilities of the director who left earlier this year. The court has approved one out-of-class pay extension. The department is requesting one additional extension that would take us through January if granted, or of course, we won't take it that long if the position is filled before then. And we're estimating that the cost to the general fund will be approximately $5,000, including fringe benefits.
Move for approval with one question. When are we going to have a new director?
Well, we are still in the recruitment process, Commissioner. We've reached out to Judge Carr to assist us with that outreach. We are doing our usual recruitment. In addition to that, we've reached out to MHMR, Tarrant County, and also the U.S. Marine Corps. And again, Judge Carr is helping us with additional outreach. If you all have other suggestions, we're open to hearing about those. But we are in the recruitment process currently.
Remember, we went out to the second time for another set of potential recruits, and we're in that process right now, but that should close fairly soon.
Well, let me second to make this discussion legal.
We have a motion and a second. Any further discussion? Please vote. Motion passes unanimously.
Thank you.
Mr. Tenasia. Good morning.
Good morning, Vinny.
Good morning.
For the court record, I'm Vinny Taneja, Director of Public Health for Tarrant County. We're requesting one item for approval today. It is a managed care provider agreement, an insurance contract with the HealthSpring Life and Hilt Insurance Company, and that would provide a reimbursement for all our billable service. That would include immunizations, lab services, STD testing, TB testing, HIV services, et cetera.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Thank you.
Thank you.
This was just to make sure you guys could jump up and get the cameras turned on. You'll have another opportunity in a little bit. Mr. Beach, nope. Come on forward.
Morning.
Good morning.
I wanted to pass on some information to you. Jack couldn't be here today. He has a relative who's gravely ill right now, and he's with him up in the Mayo Clinic up in Minnesota. He should be back down Thursday, and then he'll be out another couple of days next week. But he just wanted me to advise you that.
Tell him we'll be thinking about it.
Thank you, and he did ask for that too. Thank you very much. The other thing I wanted to mention is that budget and human resources. Human resources and purchasing is in the throes of making chili right now, and we've got that cooking down on the third floor for the United Way. Very strong. We've got chili pie and chili, and we're also selling our Christmas decorations again this year, and they're going pretty quick. So just want to pass that on.
Does that have a Tarrant County emblem on it?
No, it has a courthouse on it.
Oh, so you're attempting to sell an image of the.
Yes, sir. Yeah, we checked with the legal department. They said that was fine. I know this has come up before.
Can I talk about my barbecue that's coming up next week?
No.
How'd your fish fry go last?
It went quite well without any of you being present.
Let me assure you, I'd have much rather been with you than where I was last Friday about that time of the day.
No, we had a nice crowd. The food was good, and we missed all of you and Ann.
Well, you can all make that up if you come to mine.
Well, J.D., I just want to tell you that even though I wasn't there, I sent a big check.
You did. Thank you very much.
I was with Roy.
Yeah, he was.
Well, since he verifies it, I'll accept.
Go right ahead.
Okay, we're ready?
This gets too far.
Okay. Well, we do have two items for your consideration this morning. The first is bid number 2014-157. This is our annual contract for the purchase of motor graders for all the precincts. We're asking for your approval based on a per unit price for the three vendors that are listed on your communique.
Move approval.
Second. We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our second item is for bid number 2014-176. Again, this is an annual contract for our lift repair and services. This is countywide. We're asking for permission or asking for your approval to award to the vendors listed on the communique based on the per hourly rate and percentage markup for parts.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Commissioner Fickus.
Yes, I have.
Thank you, Rod.
Local with City of South Lake, do some road work on White Chapel. And, move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Are there any appointments today? There being none, then we will ask for your approval of the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Any discussion? Please vote. Motion passes unanimously. Briefing items, Mr. Manions?
Thank you, Your Honor. Members of the Court, we have two briefing items. Both of those are from the Public Health Department. The first one concerns the Health Department's Medicaid 1115 waiver delivery system program. Mr. Clark is going to address the court at this time.
Good morning.
Good morning.
Good morning.
Morning, Commissioners. Morning, Judge. I'm Corey Clark, and I am the District Project Operations Manager for Public Health. I appreciate the opportunity to brief you and give you an update on the 15 waiver and the progress we've made over the last briefing, which was approximately 8 months ago. A lot has changed over this last 8 months, a lot of implementation of the project objectives, and very excited to go through and actually explain some of these things to you. Because we're changing. Okay, thank you. As you may recall, if we go back in 2012, we had this waiver rollout, and the intent was to have this executed, all projects approved throughout the state in late 2012, early 2013. All projects for the state actually were delayed until mid-2013 and late 2013. So that immediately created a challenge for all the providers and all of the entities within the state to get caught up, if you will, because the deliverables did not go away. So the deliverables actually remained in place for that mid-2013 and the late 2013. With that said, we're happy to report that we have closed the gap. From October of last year until now, we have substantially increased our movement towards those milestones and we've caught up. So I'm happy to say that. Just as a quick review.
You're fixing to be happier.
All right.
Keep going.
As a quick review of our projects that we have, and we go ahead and roll to the next one. There we go. We have a total of 9 projects. Of those 9 projects, the top 4 on this list right here were the ones that were approved early in 2013. And Keisha Leatherman is our project manager for tobacco cessation, and this project is to, of course, decrease tobacco use within the county. Stephanie Adams is our project manager for antenatal steroids. This project, again, directed towards the mothers in our county that in the attempt to reduce preterm birth through education and the utilization of medication. Those are collaborations that we're doing with various different entities within the county. Glenda Redeemer is our project manager for chronic disease self-management. This project intends to go out, educate, and to empower the community that is dealing with chronic disease, give them tools and knowledge so that they can manage that. The bottom two projects, project manager Jeremy Gallops. The first one was approved back in April. The second one was approved in September. Both of these are directed towards improving the medication completion rates of individuals that are diagnosed with latent tuberculosis infection. Next slide, please.
Maybe.
Okay. All right. Let's go back one.
Go back one. There we go.
So Mark Wilson, our project manager for both of our Arlington initiatives. Both of these projects are intended to improve the outreach and education, one, to the adolescent population within Arlington in regards to sexually transmitted diseases. And the clinic expansion is to then increase the opportunity or the access to the clinic. So essentially just growing or expanding what we already had in place. Shripa Arya, our Health Information Exchange project manager. This program is in place to create a bidirectional flow of health information from the Public Health Department to various other entities. Right now we are interfacing and working with the Tarrant County Hospital District to create this data flow and exchange. Specifically, pertussis is what we're working on right now. So early capture of the disease so we can potentially intervene early. This is a tool that was not in place. We didn't have the opportunity or the ability to capture these prior to this implementation. And then falls prevention, that's our 9th project. It's a 3-year project, just recently approved here a couple of months back, and directed towards the residents 60 and older in Tarrant County. Give them confidence with ambulation or in movement and walking to help manage falls and decrease the chance of falls in their homes. Next slide. The timeline here, you can see in the red along the top, you can see the identification of those projects. And again, I stress all of these projects were intended for approval late in 2012 or early 2013, with our first milestones being to be reported in August and October. So by the time of these projects were already approved, we were already playing catch-up. Along the bottom, you can see in green represents all of the payments throughout the time continuum since we first started. With the last payment, the $8.9 million, is the anticipated reporting payment that we're reporting actually this month.
Let me ask, if we could go back one slide. So as a result of this, prior to DSREP, prior to the 1114 waiver, none of these monies were coming in?
That's correct.
So we're picking up as a result of, again, projects for which we have to provide results in order to be reimbursed. We have picked up 5, 6, 12, $21 million, $21.5 million.
That's correct. And that was adding up through the second to the last number there. That's correct.
Let me ask you to go back one more slide. The PRIDE program was instituted as a result of an initiative that I started. It was meant to address the prevalence of STDs among youth countywide. It was certainly not the intention for it to just focus on Arlington. How did that come about?
So actually, in fact, this is not, we did not reduce the footprint of PRIDE to Arlington. The PRIDE initiatives that are going on within the county are still going on. This specifically was an initiative to expand to Arlington because that was identified as a target area that needed the most direct interface. So this is just simply expanding what we currently do and actually putting it into the Arlington area.
Do you need to move forward?
Right there. All right. So this is a good snapshot of all of the projects. You can see them demonstrated at the bottom. And the cylinders indicate total valuation opportunity. So this is the total valuation of this project should we achieve every milestone that we've signed up for, if you will. On the far left, you'll see the startup. The startup funding was just for that, hiring people, getting administrative costs, supplies, training, et cetera, those types of things. This was early in 2013 that this funding came in. You see the next reported, or the next color of the cylinder is the red area. That's reported and paid. So this goes back to what we were talking about, August of 2013, October of 2013, and April of 2014. We have submitted milestones, reported them achieved. CMS has then approved them, and we have actually received funding for that.
So the remainder part, which you say future reporting, along with that will come future reimbursements to the extent that we meet our goals and our
Yes, sir.
criteria.
Yes, sir.
So much more than what we previously mentioned as the 21 million.
That's correct.
Very good.
And you can see here demonstrated in the green cylinders. The green cylinders are what we are reporting this month, so October. And that represents the 8.9 million that you saw on the previous slide. And we actually will break this down in the next slide a little clearer. So this takes all the projects, puts them all together as one big pie piece. And as you can see at the bottom, the total current valuation is 57 million approximately. So the 2.4 million in the blue area is that administrative onboarding. The 10.3 million is what's already been received, those two together, plus the 8.9 million of what we're actually reporting out at this time frame now. So it would actually be, back to your question, Judge, the actually received funds to this date would be the 2.4 million and the 10 million as seen on those first two pie charts. The 8.9 million is what we're reporting this demonstration period, which will be paid out in January.
Are we on target to achieve the entire set of objectives and get all of the money?
Yes, sir, but we are playing catch up right now. We're at about 42% of pace. Our pace should be at October 1, we should be at about 50%. And of course, we are in the same boat that everyone is catching up and closing that pace. By April of this year, we should be almost at pace. Just a few projects will have reportables. And then in October of next year, we should be caught up with the exception of one project. And it's sort of a tricky question because we do have this year of carryover that they're allotting us. So we have not put any money at risk at this point, nor do we see the money at risk right now through our next reporting period.
Nor do we intend to leave one dime on the table.
Yes, sir, understand.
Thank you.
So as you can see with the rest of the pie chart here, the 57 million minus our intergovernmental transfer, which is our obligation for this project, is approximately 42%, leaves us about 33.1 million net. That's before expenses.
Let's talk about the tobacco cessation. How are we reducing the smoking rate and the use of tobacco? How are we doing that?
Well,
just a general overview.
Sure. Well, all of these projects through October of this year have been developing baselines. And so the baseline is to start capturing new patients, new enrollees, whatever it may be, whatever the project calls for. Specifically for tobacco, it would be enrollees into the tobacco cessation program. So there is a comprehensive program that they go through with our community health workers to teach them on all the techniques and skills to reduce their dependence on tobacco. Now, how do we validate or prove that that's being effective? That will now be accomplished throughout this next year. So determining whether or not they maintain, their cessation rates maintain. So we'll be monitoring those in 90-day, 180-day, 365-day chunks. The real outcomes of the DISRUPT programs are in years 4 and 5. That's you did something, you created a baseline. Now, did you improve upon that baseline? So that's what we'll be measuring in April and October of this year. So we've collected our data. We've got individuals into our programs. Now we have to monitor what the outputs of those projects were.
Do you know which population group has the higher smoking rate?
We do. Our project manager and team has identified very specific areas that have the highest prevalence of tobacco. Marketing outreach, penetration into the areas, all of those are focused on hitting many of those areas first, and then those are rolled out each year to hit other different market areas as the project moves forward.
Thank you.
Next slide, please. Oops. All right. Next one.
One more slide, please.
Other way.
Okay, so this slide right here illustrates, whereas the last slide illustrated valuation in terms of dollars, this actually represents the valuation in terms of work as it relates to milestones. So the milestones themselves, you can see in that first pie chart, 21, the red pie chart were achieved, whereas in this reporting period, we've achieved 28 of those. So a substantial increase in this one reporting period over the last 3 reporting periods. So again, we're closing the gap there. And as I said earlier, right now, if 50% is our pace, 59 milestones, we're at 49 at this point in time. So we're closing that gap. Whereas when we implemented the project, of course, we had only reported 1 or 2 milestones. Next slide, please. This is our financials through the end of the year, beginning of calendar year, or next calendar year. You can see our cash balance over on the right, the $5.07 million. That's our carry forward minus our IGTs, our expenses. So a cash balance right now as of October of $5.07 million. As we move forward with the anticipation of the milestones that we're reporting out this month, you can see the payment valuation of $8.9 million there, minus expenses, et cetera, gives us a cash balance in January of about $9.3 million.
I'd just like to make a comment for the information of the court, and it's about the IGT, the intergovernmental transfer that supports these and other programs, helps us draw down Medicaid and disproportionate share dollars for the state of Texas. There is a bill pending in Congress that, under the guise of transparency in the Medicaid program, would prohibit local units of government from putting up the IGT to draw down Medicaid dollars. Now, with the state of Texas's record on funding Medicaid, I don't have the confidence that they're going to step up and put up the money that we and the other disproportionate share hospitals have been putting up to draw down Medicaid dollars for the state of Texas. If they don't, we're going to be in crisis mode in all of our public and many of our private hospitals that receive Medicaid dollars, receive DSRIP dollars, because it will just flat put us out of business.
Well, and there's actually some question as to whether or not the practice in the past is one that the federal government felt like they approved, and there's some discussion as to right now whether they want some money back for our for previous matching to IGTs. And so I know that there's conversations going on right now as it pertains to the IGT money that our public hospitals have been sending, and whether or not in the, currently are sending, and then certainly in the future would send. And I think they're having a dialogue with the state about the fact that the state might need to be looking at that. So, well, good point.
This is something that we need to weigh in to in Washington on our own behalf, and not wait for the state to carry our water.
It might be a good thing to talk with Pipes and Corley about.
Absolutely.
This is another reason why we need to treat the district revenue like grant revenue instead of like it's a permanent source of revenue.
Absolutely.
And I think that's what we have done. I mean, we've got revenue coming in. That requires us to hire folks to do those programs, but I don't think there's any question that if those programs go away, so will those folks have to go away with them.
Yes, sir. I mean, I think there definitely needs to be a discussion to figure out which one of those have a sustainable element outside of the district
Yes.
funding. Which brings me into the next steps here, which I can just drop down to the third one here, so since we're sort of on the subject of this, the district renewal. And so the demonstration waiver will continue out through September of 2016. That'll be the end of demonstration year 5. So over the next year, the state has an opportunity to resubmit for waiver extension and craft that message on however they deem fit. So they're going to be firing back to the regions and the providers to craft that up and to develop lessons learned from implementation, et cetera, et cetera. So they have a year to push that through. And then, of course, depending upon the flavor of that presentation will depend upon what type of renewal it could be. Renewals could go anywhere from 3 to 5 years historically. The plan modification, back to the top of the page, this is an initiative that the CMS has allowed each one of the regions that if we have a project or projects that need minor tweaks in their scope, we can do that. But if we have other projects that may have a scope change, that we can submit those too. So we have one project that we are, that could potentially have a minor, or could have a valuation modification, but we're not sure. We don't understand necessarily the methodology, but we'll find out in November on that project. The next item is the midpoint assessment. Again, CMS has been charged, or through their funding protocol, to provide an external agency to come in and audit to make sure we're doing what we said we were going to do, essentially. And they're monitoring and evaluating everything up through this past April. So basically everything we've reported. When I say we, I mean the state. They are looking at 50% of all projects right now across the state. We happen to be tagged for 4 of our 9, so very in line with what the average is across the state. That should be within the next month, and they should close that out by the end of the year. So more to follow on that, on what they're looking for and you know, the information that they're wanting. And then lastly, of course, the milestone completion. Every 6 months we're reporting milestones out, and every 6 months the payments are coming in relative to those reporting achievements. So the last slide here, this is the good stuff. This is the money slide, if you will, in terms of Tarrant County impact. And this is, I'd really like you to focus on that employees hired line and that project manager line, those rows across there, because this is really where the service line effect is happening. These project managers have hired these individuals. This team of 36, if you will, if you look in the October column, have been instrumental in achieving those 49 milestones. And those 49 milestones are anything from developing a strategy to hiring people to training people to developing infrastructure, creating outreach opportunities. But they all relate to that bottom line number there, the Tarrant County patient impact. These 5,469, this number here represents the patients here in Tarrant County that prior to the district program, either maybe were not affected by the project or now maybe there's an expansion of services, whether it's through any of our outreach, the CDS&P, tobacco, our Matter of Balance program, or our Pride outreach. These are individuals within those programs that have now been educated and gone through a full regimen of this training. The same applies for our TB programs, our HIE program. That number consists of pertussis cases that have been captured that we couldn't capture before through that health information exchange. And also with our steroid program, the mothers that we're trying to help them reduce that level of preterm birth in the community. And then, of course, our expansion clinics, our FTD, we're improving access to those. So I think that's the proud moment there that all these employees have, and this number is going to expand very quickly. As you can see, the movement from February until October, it's going to continue on a very rapid pace. Next slide, please. And with that said, we have to mention the collaboration that we have had with our community partners. I asked all of our project managers to fire me over a list of those community partners that we've been sharing in developing this district projects. And the list was so large it would have taken up probably 3 or 4 slides. But I wanted to put in and recognize that, in fact, without the community members, we would not have been able to achieve our milestones. In fact, we would not have been able to become close to achieving those milestones. So we definitely appreciate their collaboration. And some of these collaborations are brand new, so they're not necessarily just expansions on old collaborations, they're new ones. We look forward to the next 6 months and the next year. At 42%, we hope to close the gap on that to make it, Roger right up with our appropriate pace, and we see us hitting that in the next reporting period, or at least the one in October. We understand that there's hiccups along the way, and we just have to adjust and be ready for those.
Any questions? Thank you very much. It was a very good presentation.
Thank you.
Thank you. Members of the court, we have one final briefing. This is the weekly update. Mr. Taneja is here to address the court at this time.
Well, members of the court, I wanted to close the loop on something. Last 2 briefings, the question has been asked, what's the status of our flu vaccine? And I had promised you all that I'll personally follow up with the manufacturer, which I did last week. And we've got a delivery confirmation date. They're going to deliver the vaccine to us on the 28th of October. One of the things that I should have clarified last 2 times, and my apologies for not doing that, but we do have on hand the vaccine for children vaccine for flu. So we've been giving that out to our clients. And this is the private purchase vaccine that we use for adults and obviously for our county staff as well. So our staff are already making arrangements to, make appointments and dates set up for county staff to receive it. And after the 28th, any adults who want to come to the health department and get the vaccine, the quadrivalent strain of the vaccine is going to be available with us starting on the 28th. And I bring that to your attention because flu season is upon us. Weather has cooled down. A lot of our focus and attention has been on Ebola, rightfully so. It's a very important topic. But yesterday there was a school meeting with our partners about Ebola, and Commissioner Brooks brought the point to light very eloquently, grounded us in the truth that Ebola has had 1 death in the United States, just 1. And flu, on the other hand, kills 30,000 to 35,000 people every year. So we need to keep that in perspective and protect ourselves against the flu. So I encourage everybody and take this opportunity to remind everybody that please get your flu shot. It's a very serious disease. We tend to get complacent, oh, it's just a flu. It's not. It can be very deadly, and it takes lives every year without fail. So we need to make sure that we do that. We get the flu vaccine. There are other public health methods to protect yourself as well. So those are washing your hands throughout the day on a regular basis with warm water and soap. People tend to get complacent again, so I'll use an alcohol hand sanitizer. That's a good supplement, not a replacement for hand washing. Cover your cough and sneezes. The recommended method is in your sleeve, so not on your hands again because you're going to tend to spread that. And, so that's that. And, of course, the hardest one that we should all try to practice, if you're sick, stay home, and especially if you have a sick child, keep them home from school and daycare because flu does tend to spread very quickly. So if we practice all of those things, we can have a great impact on protecting the health of our community from the flu. Now, again, I'm not going to forget about getting you an update on what's going on with Ebola, and we've got some good news there as well. As you all know, we in public health have been monitoring a lot of folks who were considered contacts of the Ebola cases in Dallas area. Yesterday was a good day. We had about 48 of those individuals complete their 21-day monitoring period. They completed that successfully without getting any symptoms of Ebola. So now they're considered, not at risk of developing the disease. So with that, it marks the beginning of the fall off of these individuals from the watch list. There's still quite a few folks that are, remaining on the list. I think across the nation, there's about 245, including, some in Texas and some in Ohio. They're still on the monitoring list. But eventually, we expect all of them to fall off. What we're hoping for is that none of them develop any symptoms, and we don't have any problems with Ebola anymore. There were 2 other cases, as you remember, 2 healthcare workers who fell sick. They have been transferred out to, one has been sent to Bethesda, Maryland, to National Institutes of Health. The other one has been flown out to Emory University in Atlanta. So as of right now, there are no known cases of Ebola in Texas. And we in Tarrant County have not had a single case of Ebola. And that's very important to remember because, public is very worried. We're feeling that in our health department. We're getting a lot of calls. And to address those concerns, we've been reaching out to a lot of our partners. As I mentioned earlier, we had a meeting with our school partners yesterday, which was a very productive meeting. We had a lot of feedback from them. We worked with them to give them school guidance. And we feel comfortable that, now we've come to a consensus on, what we need to do when we get to the school setting. Also, we've met with our, city managers via teleconference a couple of times. We feel very comfortable that we're sharing information on both ends. They're giving us their feedback. We're giving them information that we have on hand. And we're also keeping a close eye on changing guidance. Yesterday, CDC issued new guidance for healthcare workers and how they need to protect themselves against Ebola. And we're already reviewing that information. We plan to reach out to our healthcare partners in the next couple of days to make sure that everybody's received it, understands it, and they're practicing those guidelines to protect our healthcare workers who may, come in exposure with Ebola patients. So with that, I also want to remind everybody that, because we have no Ebola cases, all we're left is with contacts that we're monitoring. And we're going to continue to monitor those folks very closely. And, if there are any questions from anyone, we've got a lot of information on our website. There was a request to translate some of that information, especially the Ebola Bulletin, which is the frequently asked questions. So now it's available on our website in English, Spanish, French, and Vietnamese. We're reaching out to our media partners to distribute that information as well in those languages. And also, we've opened up a Ebola information hotline for the general public to call. The number for that is 817-248-6299. And that's for anybody who doesn't have access to the internet, or if they are reading through the information and still have questions or are not clear on something, feel free to give us a call. We're here to help you understand all of that. We don't want the public to not understand what this is, because fear is our biggest enemy, bigger than Ebola. And the best weapon to fight fear is education. And we're here to help you understand all of that information and make sure that we're prepared to fight Ebola. Thank you. Any questions?
One thing I would say, again, I think we have been very busy over the last several weeks, and even really before that in preparing for this. I would encourage you, if you've not had a chance to go to the website, look at the message from our public health director. In addition to kind of keeping that up to date on a daily basis for any changes that may have occurred, there is also an attachment there. We hear many terms being used to describe the various folks that are in some way involved in this process. You'll hear case, which is someone who actually has Ebola. You'll hear contact, which is someone who has actually been in the close proximity of a case. You'll see the term no-risk people, which it goes on to define. And you'll also hear the phrase contact of a contact, which is really the same as the no-risk person or the no-risk people. I think Vinny and his folks have done a great job of really explaining that. I think it's important to remember that we have a science that talks about the transmission of the disease, and then we have also protocols for treatment. The science of the disease and the transmission of that disease has not changed. This disease has been around for approximately 38 years. Through that period, the science of the disease and the transmission of that disease has matured and has not changed. What we have seen change over the last 3 weeks as it pertains to Ebola in the United States is the precautions used in the treating of the disease. And that has continued to evolve over the last 3 weeks as we've actually had hands-on experience to treat that. So again, if you will read that website, if you will refer people who have questions to that website, I think that will go a long way to answering your questions and hopefully dispelling a lot of the rumors or myths that may be going around. We've had, as Vinnie mentioned, we've had some great conversations with different groups. We've talked with the EMS directors. We've talked with the providers and the hospitals. We've talked with the city managers. We've talked with the school folks. And I believe that they all feel very comfortable, that they know who to call if they end up having questions. And that's the one thing, you know, they can't put out an article that has everything described in it or everything and all examples told. But what they have said is, here's the basic information, and if you have additional questions with regards to the folks that you may be coming in contact with, how you go about, you know, any of the cleanup, or any of those types of things, please call them and give them the opportunity to help you better understand the science and to not be influenced by the myths or of some of the fears. Thank you again for everything y'all have done at this point in time.
Thank you all.
Thank you.
Thank you, Vinnie.
That's all we have at this time, Your Honor.
Thank you. We will now recess our open meeting and proceed to close to discuss items exempted under sections 551.071, 072, 074, 076, and 087 of the Texas Government Code. We're fixing to find out in the next 4 years.
Commissioner Lynn is not here.
Craig Goldman was there.
We ready? All we need is a quorum.
Well, the commissioner and I are gonna go have
Bowl of chili?
chili.
Having returned from our closed session and there being no business to conduct at this time, we are adjourned.